Hello and welcome. GAVI, the Vaccine Alliance, earlier called the Global Alliance for Vaccine and Immunization, has pledged about 20% of the vaccine output for India. That support translates into almost 200 million doses worth $1.4 billion. Now, the question now is, given that the vaccines have been already rolled out and people are being vaccinated in India and of course a little faster and ahead in other parts of the world, to what extent is this effort going to coincide with the rising or the likely rising herd immunity in the country? But more importantly, what is the vaccine supply chain looking like all over the world, and where is it going, and how is it being distributed in the race against COVID-19, the pandemic, as it continues to wreak havoc in many countries? To discuss this, I am joined by Anuradha Gupta. She is the Deputy Chief Executive Officer of GAVI. Before GAVI, she worked as a Mission Director of the National Health Mission in India. She's also served as co-chair of the Partnership for Maternal, Newborn and Child Health, PMNCH, and is currently a member of the PMNCH board. GAVI, just to give you a background, has helped vaccinate more than 822 million children in the world's poorest country, preventing more than 14 million future deaths. Ms. Gupta, thank you very much for joining us. So give us a broad sense on what is happening today. In terms of the total demand as projected at this point for vaccines, and what is the supply or the supply chain looking like?
So, the pandemic is still raging. There is a sharp surge in many countries with several new variants now rearing their head, which are spreading faster and could actually be also more lethal. And as a result, many countries have imposed new lockdown restrictions and travel bans. COVID cases have already crossed 100 million, 2 million people have already lost their lives. So what we are seeing now is a very encouraging trend that we have a growing portfolio of vaccines that is ready and ripe for approval. And the vaccines are being approved for use in countries and are being rolled out globally, including in India. However, I would want to emphasize that this is not a sprint. We have to brace ourselves for a very long and arduous marathon. There are challenges relating to supply and demand, funding, logistics, and we would need steadfast global solidarity and national preparedness to put an end to the acute phase of the pandemic.
Right, and I'm going to come to India in a second, but before I do that, give us a sense of what it is globally. I mean, what is the perceived vaccine demand at this point of time? How many billion doses? Where do we stand as a planet in terms of meeting that, and also the role of GAVI within that?
So, the demand is global because it is a pandemic. And so there is no country which is untouched by this disease. And we really need to vaccinate at least high-risk populations in every country because in a highly interconnected world, nobody is safe until everyone is safe. So really the demand for vaccines in 2021 is going to far outstrip supply. And our projection at this point is that through the COVAX facility, which actually brings together 190 countries, both rich and poor, we should be able to deliver 2 billion doses in 2021. The doses could start to flow into countries as early as in February with a ramp up in March. But it is really the second half of this year when you would start to see scaled up efforts in most of the countries around the globe.
Right.
So therefore, in this year, I would say that you might see about 40 to 50% population covered in richer countries, but roughly about 20% population covered in all countries,
right,
at a minimum.
Right, and for those of our viewers or readers who may not understand the distinction, explain to us what is the difference between the vaccine doses that GAVI is rolling out versus the vaccines that have already been administered or are being administered in many countries, including the United States, Europe, Middle East, and of course India?
So GAVI actually is in the forefront of the COVAX facility, which is actually a global effort to bring together all countries to plan for fair and equitable supply of vaccines around the globe. And the whole idea is that there should be a global solution to a global problem, that there shouldn't be vaccine nationalism, there shouldn't be hoarding of vaccines by one country, but that we should try and work together to make sure that there is fair distribution of these vaccines, and also at speed and at scale. So clearly, as I said, because a demand in this year is going to outstrip supply, therefore we would have to take a very targeted approach to using the vaccines that are going to be available. And that really is going to hold the key to success. If we are able to protect the health workforce, elderly people, and those with comorbidities, that itself should have an impact on reducing hospitalizations and cases of severe illness and deaths. And that would also save health systems from getting overwhelmed. So through the COVAX facility, we actually are going to support 92 countries which may not have the fiscal capacity to buy COVID-19 vaccines themselves. So our goal is to mobilize more than $7 billion to help these countries and deliver about 1.3 billion doses in this year to these 92 countries, so that they can cover up to 20% of their population and possibly more, starting with high priority groups.
Right. Sorry, go ahead.
The rich countries are also a part of the COVAX facility. So they are self-financing participants. So they pay for their vaccines. We at the COVAX facility actually do demand pooling globally, and that helps us manage distribution and supply of vaccines in a much more equitable fashion. The rich countries also are mobilizing funding to actually pay for COVID-19 vaccines, as I said, for 92 countries that we are also supporting in line with the GAVI model, because GAVI model is predicated on providing access to vaccines in those countries which are lower income and therefore sometimes do not have the fiscal capacity to fully pay for those vaccines.
Right. So if I understood that right, your vaccines or the doses that you're holding or will source will start rolling out in February. The vaccines in general really come from the same pool of manufacturers. Rich countries are buying it directly, whereas you will or have begun sourcing it also from the same manufacturers and will start distributing it.
So it is a mixed picture, because there are bilateral deals, of course, that have been struck by some countries, but there are also rich countries who are a part of COVAX facility who would be receiving doses only through the COVAX facility and do not have their bilateral deals.
Right. So I'm just coming back to the timeline. I mean, so if you're going to start rolling out from February, and obviously many of those vaccines are going towards the poorer countries. Now, can you tell us how this will start moving logistically? And also, I mean, as an extension, I'm sure you now have a war room or have had a war room for some time. What does it look like inside?
Yeah, so for us, of course, it is a warlike situation, and we are working on a war footing. So we are essentially focused on 4 key things. First is advocating for global solidarity and multilateral coordination, because that alone can ensure fair and equitable access to COVID vaccines. The second, and very important, is securing agreements with manufacturers to supply 2 billion doses in 2021 to countries, which include both self-financing countries and also countries that are our advanced market commitment countries, which we would support and are participating in COVAX facility. And then we want to raise at least $7 billion to provide, as I said, between 1 and 1.5 billion vaccine doses to those 92 countries that have limited fiscal capacity to buy COVID vaccines themselves. And then finally, supporting these 92 countries to effectively deliver these vaccines to priority groups. And as you can imagine, this is a mammoth undertaking that requires extensive planning, very deft stakeholders management and dialogue, as well as relentless advocacy.
Right. So, some things have changed perhaps since the original planning for this project began, maybe about anywhere between 1 year to maybe a little longer. For instance, it's clear now that in India, the number of cases are slowly dropping. The number of deaths has also dropped quite sharply. Of course, we don't know at this point whether things can reverse, and things are known to have reversed in other countries. But at this point of time, it does look like the pandemic is coming under control in India. Does this situation change the way you will or likely look at the distribution of vaccines also?
So first of all, I do want to emphasize the point that the virus is still winning, and that it is too early to conclude that the pandemic is under control in any country, because we have seen big spikes in infections and also mortality in several countries. And really the containment of cases is directly related to the measures that countries are currently taking, in terms of social distancing, lockdown measures, travel bans, and clearly these are not sustainable. So that India also now has imposed a travel ban because, South Africa variant is supposed to be not just more transmissible, but also probably more deadly. And also it is still being studied to what extent it is amenable to vaccines that have been brought forward. So there are several risks here, and therefore it is very important that in all countries we start vaccination and focus on vaccination of high priority groups so that transmission is reduced. And we can save the health systems from getting overwhelmed with too many cases of hospitalization. And also high-risk groups can actually be saved from unnecessary deaths.
Right. So you're saying essentially that, regardless of what happens, whether in some countries it goes down or in some countries it goes up, your original timetable for vaccine rollout, distribution and administering will stand as is.
Absolutely. Absolutely.
Right.
So our effort, we are very focused on making sure that every country receives doses of vaccines and that we support them in cataloging their priority populations with care and then actually making sure that they are put into the arms of people who need them.
Right. The next question is to do with vaccine hesitancy. Now, in India, maybe not so much in other countries, we are clearly, at least at this point, seeing some hesitancy because of various reasons. It could be traditional, it could be to do with the lack of data on one vaccine and its trials. So, and maybe there could be other reasons, but there is some discomfort and clearly not as many people are turning up at this point to take the vaccines. How do you think we could address that situation?
So vaccine hesitancy is a global phenomenon, and there are several reasons for that. For example, sometimes younger populations do not perceive themselves at risk and may not be very keen on receiving that vaccine, but with very little understanding that they could actually transmit that disease to elderly populations or those who are suffering from comorbidities. There is also sometimes the fear of adverse events, which is not limited only to COVID-19 vaccines, but it is true of all vaccines, including childhood vaccination. And of course, then we have a lot of rumors and misinformation. And we always say with this pandemic, there is also an infodemic, right? Where the social media platforms are being used to spread misinformation, disinformation, rumors. So I do think that vaccine hesitancy is something that has to be proactively addressed, the governments, the leaders, whether they're opinion leaders, they're religious leaders, political leaders, everybody has to join hands in order to make sure that good information, right information is provided to people. Because in my mind, the best antidote to misinformation is good information. Communities also trust their health providers. So I think doctors and frontline health workers have a very big role to play. And for them to actually inspire confidence among communities, they need to be equipped with the right tools, right interpersonal skills, and right information. And finally, I think the trust between governments and people has to be bolstered, because people have to believe that their governments are in charge of, are responsible to protect their health and well-being, and they take that responsibility seriously.
Right. There are new strains coming out from Bahrain to United Kingdom to South Africa, and each one, as you pointed out, can also be or has been shown to be more dangerous. Now, is this something that was anticipated, the mutations at the early stages of the GAVI planning for COVID-19? And if so, what was the thinking? Or is it something that's now being encountered, and therefore which obviously begs the next question, to what extent will these vaccines be effective?
The scientific community has always been aware of the risk of mutations, because as the virus spreads, it gets replicated, it also mutates. There is therefore a lot of real-time research and understanding of the phenomenon. That is why we are getting this information so rapidly about new variants that are being seen, whether they are in South Africa or UK or Brazil or several other countries. So these are very much anticipated, expected, and there is a lot of work that is going on under COVAX research and development to actually get prepared to develop vaccines, first of all, to test the efficacy of approved vaccines against these variants, the new variants. And second is and to also develop new vaccines for new variants wherever required and at a very rapid pace. The timelines that are actually being envisioned are very aggressive, 100 days. And right. I think that really is a testament to the scientific advancement that we have seen during this pandemic. And I really feel this pandemic has tested human ingenuity and really brought out the best in terms of scientific collaboration and global solidarity.
Right. Last question, Ms. Gupta. Anyone watching this will want to know, do I take the vaccine? If I do so, then what do I need to know, or who do I ask before I actually do that?
So my fervent plea to everybody would be, you must come forward to take the vaccine because you're not just protecting yourself, you're also contributing to protecting others. So it is also a cause that you're serving by coming forward for vaccination. The pandemic has destroyed people's lives and livelihoods, and it is important that economies get back on track, that people are not pushed into poverty, and that so many families don't have to lose their dear ones. So please come forward. Please have trust in the scientific community of your country and the regulators. They are the ones who are going to examine and assess the aspects of safety and efficacy of all the vaccine candidates that are being brought forward. And with that trust in your heart and in your mind, you should absolutely avail the first possible opportunity to get vaccinated.
Right. That's a positive note to end on. Anuradha Gupta, Deputy CEO of GAVI, the Vaccine Alliance, joining us from Geneva. Thank you very much for speaking with us.
Thank you so much. Thanks a lot. It was a pleasure.